Epilepsy is a neurological disease that affects approximately 1% of the population. It's the second most common disease of the brain. Now, in Ireland, those numbers haven't really changed over time. What has changed really is the complexity of the disease. So it's becoming exceedingly complex.
Epilepsy nurse practitioners are trained to assist the neurology team in the diagnosis and confirmation of a seizure disorder. We're nurse prescribers and we're very au fait with managing the anti-seizure medications, and we have in-depth knowledge on the complexities of the epilepsy disorder.
I play a lot of sport, and my learnings from sport I put into my living with epilepsy. So that's about surrounding yourself with a great team. And if you transfer that to epilepsy, and which is what I did, I got a great counsellor to deal with the mental side, great family and friends for the emotional support, and then obviously for the physical side, you're going to your consultant. Interestingly, I had no idea about epilepsy specialist nurses.
Like, what a brilliant analogy for what we need to do with patients with epilepsy. They need to come in and feel like they're the most important person, that the performance, living their lives to the best of their ability, which is really the core message of Epilepsy Ireland. That has to be done with a team of specialists, each with a particular string to their bow. Epilepsy nurses are bringing a lot of these skills.
I found them the best educators, obviously alongside the consultant, but they speak different languages.
We link people in also to advocacy groups such as Epilepsy Ireland when epilepsy impacts on the psychosocial aspects of their life. We really enhance the collaborative team approach to epilepsy management to ensure that people receive a very high quality standardised epilepsy care. I think we've achieved a huge amount over the last 20 years since the evolution of this role, but with additional resources we can do a whole lot more. I feel we can really improve those waiting lists further, and we can reduce length of stays in hospitals in the acute arm of seizure presentation, while also avoiding the unnecessary presentations to hospital. We are a pivotal point of contact for the patient to make sure they have an open, accessible service for them, their families, their local hospitals, and also their GPs.
We need more specialist nurses. We don't have enough. They play such a vital role, and I've only come to appreciate that role recently, and I wish I'd had it in my life from the beginning.
People shouldn't have to wait for access to care. Their GPs can contact us directly.
Epilepsy nurses remind me of a great quote by Dumbledore. Happiness can be found in the darkest of times if one only remembers to turn on the light. And for me, specialist nurses remind me to turn on that light, and they offer hope and to help you live your best life.
From my point of view, epilepsy nurses are core to the emerging evidence worldwide of all the needs of patients with epilepsy. So let's do it.